Thanks, everyone. As John said, I'm Russ Jago, and I'm delighted on behalf of Sara and I to talk to you about the public health and prevention theme. This is very much a collaborative effort, though. So along with Sara and I, Jeremy Horwood and Frank de Vogt, two of our methodology leads, are really being integral in helping us shape this work, along with our excellent PPI members who really keep our feet grounded. So we'd like to thank Adele and all our colleagues for really helping with that. So I'm briefly going to give you an overview of what we've been up to. I think I don't really need to say this, but over the past 12 months, we've all been shown, public health is absolutely critical to everything that we do, and everything in our lives has changed, but particularly local public health and the response to the pandemic. Staff have had to be moved around. Sara's Director of Public Health has had to respond incredibly fast to changing circumstances. And the ARC's been really helpful in this, or we'd like to think that we have been. So we've been providing real-time evidence during the national emergency on how we can prioritise our work, things that we might need to do, way that we can optimise our resources, both during the pandemic and how we might need to think about what we're going to do differently when the pandemic ends. And also not forgetting the core business. How do we keep that going, and how do we shape it as we move forward? So in terms of our public health and prevention COVID-19 projects, we've done a randomized controlled trial of the germ defense program that John alluded to, which is a digital behavior change program to improve household infection during the pandemic. And that's really a great way of how we've been able to use the existing resources of the ARC and routine data to kind of look at how we can conduct an evaluation of something in real time. We've also looked at the experience of people who inject drugs during the COVID-19 pandemic. And we've done quite a lot of work about how we can help get schools back safely and the mitigation measures. And Jeremy's going to talk about that in a few minutes. But it's not all about COVID-19. It's important that we continue with our day-to-day public health work and how we can help the local public health and practice with research interests. So here's an example of some of the ongoing projects we've got that are not COVID related. We have the Common Ambition Project, which is working with African and Caribbean heritage members with sexual health to staff to co-design sexual health services to tackle HIV inequalities. We have the Irish Advise program, which is supporting sexual health staff to identify and respond to patients affected by domestic violence, which is something that came up earlier. We've also been implementing the Rapid Sexual Health Testing, Diagnosis and Treatment Service. We've been working with Gloucestershire on their We Can Move, which is a whole systems physical activity program. And we've been evaluating that with an embedded member of our staff to really understand the processes about that system and how we can understand how it can work better, both in terms of improving the system, but also in terms of how we might work on a systems level going forward. We've also been doing some work around childhood obesity in relation to the Cochrane review and how we can then translate that into pragmatic policy level strategies for local public health teams and how we might use that to look at inequalities and kind of change the way that we do things. So it's quite a lot that we're doing, both in relation to COVID and in relation to non-COVID programs. So that's kind of our day-to-day work. But over the past kind of 12 months, we've been working very hard with our stakeholders to come together with a set of shared priorities. We were fortunate enough to be able to have a ROG meeting, a research oversight group meeting at the end of January. And then since then, pretty much everything's had to be done via email because most of our local public health team have been very, very busy keeping the show on the road and keeping us all safe. We had some feedback from the research oversight panel, and we've then changed it to come up with our two initial priorities of projects that we're working on. The first is the Clearways Project, which is examining local clean air and air pollution plans and how that might lead to active travel and changes that have occurred as a result of the COVID pandemic. So we're working with transport, air quality and public health leaders in the first phase to understand what policies were in place and how they were shaped. We're then working with members of the public to understand their responses to these policies and how we can work with them to kind of come up with better policies. And we've done some quite interesting work, or we will be soon, under the Create to Collaborate scheme, where we're going to really work with members of the public to understand their priorities and how we can hear their voices more accurately in this work. And the other piece of work that came across as important amongst all our research oversight members was population health management. So again, John alluded to this in his introduction. But there's an awful lot of routine data out there, and we need to look at how we can use that to prioritize our local public health strategies, particularly in relation to inequalities and how we can best use our resources that are available. So we're currently working with some integrated care systems and to try and identify what are the key priorities, how can we use the resources within the ARC to understand the current use and how we can improve them. And so we've got a lot of kind of engagement work and conversations happening around that to identify a key population health management project in relation to public health. So that's a lot of work that I've tried to cover quite quickly. I'd now like to hand over to Jeremy Horwood to provide a case study of one of our recent projects. So I'm going to stop sharing now, and hopefully Jeremy can pick up the baton.
Thanks, Russ. Okay, thanks everyone. So I'm Jeremy Horwood, and with Sally Redwood, I co-lead the Behavioural and Qualitative Science team for ARC West, and I'm going to be presenting findings from our Back to School study. But first of all, I want to introduce you to our CoMMInS study. So last summer, Professor Carolyn Renton had a conversation with the Director of Public Health in Bristol to say, what can the university do to help? You know, what can we do to actually help with the recovery and resilience of the city and the region? And the answer came back was helping with schools and helping to keep schools open. So last summer, Carolyn got together a whole group of academics from across Bristol University, and we applied for some money for the CoMMInS study, which is the COVID-19 Mapping and Mitigation in Schools study. And we were successful, and we got £2.7 million to run the study. And the study is wide-reaching and has lots of elements, and these are some of the main elements to it. So the first of all is school testing, and this was last summer when we started the study, when before the government had brought in school testing. And there's the whole problem with trying to evaluate the pandemic is it's very fast moving, and so is government policy. But this is to do whole school testing to really see how COVID may be transmitted in children and to try and intervene quickly to that. Then with having this information, it would then to be mapping infections and be able to predict future infections in the city as well. Another element is using data linkaging. And this is to see what are the medium and long-term consequences for children who may be infected by COVID. Another part is around infection control. And as Russ said, this is about Lucy Yardley's germ defense intervention, which has been used lots in adults, but not been used in children. So part of the work stream is to refine it for use in schools. And this is to help behavior change around health behaviors within schools. So things like getting people to wash their hands and things like that. Another element is in information systems. So that's identifying what would be useful for schools. So that could be developing a school test and trace system, or whatever the school wants. And a work stream that Sabi and I are leading is looking at the mental well-being of both staff and students in schools. And this is really looking at the impact of these changes in schools, of these mitigation measures, and how that impacts on the well-being of the school environment. So all of this was last summer. So in July, when we found out about the money, and we had to start the study in September, but we really didn't know what was happening on the ground or what the views were of people, of staff and pupils and parents about this study. So very rapidly, we developed the Back to School study. So in July last year, we started this, and it was to interview both pupils, parents, and carers about what they thought about returning back to school, what they thought about the infection control measures in school, who they thought might be impacted by these measures most, and the attitudes towards school-based test and trace. So Ava, our researcher, did an amazing job and did a lot of interviews between July and September last year. So 15 school staff from 7 schools and 20 families from 10 schools. Particularly, we recruited through community groups because we really wanted to ensure we had diversity in our families, and 12 of the families from ethnic minority backgrounds. Then the idea was then to rapidly feed back our results back to the schools and to local authorities so they could use our findings. So what did we find? So the perceived impact of missing learning outweighed the concerns about the COVID risks and going back to schools. Families were concerned about the negative educational consequences of not being at school, and they accepted that homeschooling couldn't go on forever. So, but both families and staff did raise some concerns about vulnerable staff and family members, usually due to health, age, or ethnicity, especially because there was a lack of scientific understanding around some of these risks. These concerns were most common in ethnic minority families. And you can see here from both these quotes a sort of resigned acceptance that if you want pupils back at school, you're going to have to accept some risks from both the parents and teachers. Now, in terms of the infection control measures in schools, interviews highlight a wide variety of these measures, so things like bubbles, hand sanitizers, social distancing. And participants agreed that such measures were needed, although staff were frustrated by the lack of details in the government guidance, meaning that each school had to develop their own plans. The measures were seen as a pragmatic solution, but all participants agreed that social distancing was impossible, given the number of people and the lack of space in schools. So you can see here, there's in the quote, the pupils wondering if the school have got a magical plan to make social distancing happening. And the teacher said, it's a lot of that'll do in terms of developing the measures. In terms of the concerns about what the impact of these infection control measures would be, an important concern for staff was the impact on learning and pastoral care. So particularly for students with special educational needs or mental health issues. And this is because social distancing measures meant the teacher had to stay at the front of the class. They were unable to go to pupils' desks to help them. So there's fewer interactive lessons and less opportunity to support individual students. And as you can see from this quote, those students that are going to miss out are the ones who wouldn't normally put their hands up. So the most vulnerable may be being affected the most. So tailored support for vulnerable students and those with additional needs is needed. And school and policymakers need to think about these unintended consequences of these measures, ways to support vulnerable pupils, and how to avoid deepening inequalities that already exist. So when it came to facilitate what would help pupils actually follow these infection control measures, participants suggested that clear and consistent information and reminders was needed, engendering a sense of collective responsibility that could help students follow infection control measures. So this included emphasizing the social good, the benefits to students' families or the wider communities, and a sense of collective identity and responsibility. So very much a carrot rather than a stick approach. And you can see here from this quote about this teacher emphasizing the common good is really important. So these findings have implications for policymakers and schools, that clear and consistent information is needed from both government and from schools. And the sense of creating a sense of collective responsibility is important and may help prevent stigma when there is COVID-19 cases. Now turning to school-based testing and trace. So this was last summer, what were people's views about having testing within schools? And the majority of participants welcomed COVID-19 testing in schools to reassure staff, pupils, and parents that schools were safe, to encourage attendance, and to potentially reduce the need for school closures. Stigma relating to COVID-19 positive tests was thought to be unlikely by most participants. But a small number of concerns were raised, and this was around data security, around the anonymity of getting positive test results to people, possibly more school closures if there was testing in schools, and then the practical aspects of time, space, and administering all these tests. So you can see here that from the pupil, they're very happy to be tested, but a mother is much more cautious and uncomfortable about data being collected about their child. So what we've managed to do with the study, so the study ran from July to September. In September, we published 2 rapid reports that are published online. And just last week, our paper was published in BMJ Pediatrics Open. We've also presented findings to the Department of Education, and we've submitted 2 lots of evidence to parliamentary inquiries about the impact of COVID on education. We've also disseminated our findings widely from these rapid reports and now from the paper to SPI-B, which is the behavioural subcommittee of SAGE, Public Health England's COVID-19 Behavioural Science Cell, and also to the local authorities and schools in our regions. So I'd just like to thank all the community groups that really helped us with recruitment, and they worked incredibly hard for us over the summer to try and get some interviews. To the whole study team that took this project on top of the work they already had, and there is the reference for our paper. Happy to answer any questions.